Sure.
Do you have the votes to pass health care reform on Saturday?
You know, if the vote's held on Saturday, certainly the votes will be there. But I can tell you that as late as last night and again this morning, some of those undecided members of Congress, primarily on the Republican side, that's all we're counting on at this point, are so close to yes that I'm very optimistic that whether the vote is tomorrow or Saturday or next week, that the votes will be there to actually pass this to the Senate, make sure that it becomes better. It's not necessarily a more conservative bill, but it is a bill that lowers premiums for the American people, allows us to hopefully get onto tax reform in a very quick fashion in the coming days.
So I want to be clear here. The votes are there from the House Freedom Caucus as well as the Republicans in the House of Representatives.
You know, actually, I'm not the whip for the entire GOP conference, and so I appreciate you clarifying that. Certainly from the House Freedom Caucus, we took an official position, which means more than 80% of our members are on board. Actually, it's a little bit more than that. And so based on a previous whip count, as long as we don't have any more defections, I think that we will be there.
And do you anticipate there will be a vote Friday or Saturday? And what's
I think the jury is out. You know, we're very cautious to not set an unrealistic expectation.
You want to vote Saturday?
I mean, I certainly want to vote. You know, I wanted to vote last month. We just need to make sure we got it right for the American people. But yes, if we have to stay here and vote on it on Saturday on behalf of the American people, we're committed to do that. I think a number of my colleagues are.
So you've been in constant communication with the White House, I'm assuming, and with President Trump. Do you speak with them, I would assume, regularly, daily?
Yeah, I don't know that it's daily, but it's certainly every other day talking to someone in the administration, whether it's the president or vice president. I know that we've had some good communication with the vice president a number of times over the last 2 or 3 days. The president and vice president have been all hands on deck to make sure they get this done.
So Vice President Mike Pence has been extremely influential in helping to navigate all of this.
I think if your viewers and listeners understood the level of engagement from the White House, both at the president and vice president level, they'd be astonished. I'm surprised. As you know, as a former CEO, you know, normally those negotiations happen at a staff level, but these have been really at the highest level.
They're doing it themselves.
Yeah, it's important. It's a campaign promise that they want to fulfill.
This definitely, this has been labeled the MacArthur and Meadows Amendment, so to speak. Tell our listeners, tell our viewers what exactly it would do.
Yeah, and it's really Tom MacArthur's amendment. I've spent a lot of time with Tom, but I want to make sure that he gets really the credit, because it was his willingness to engage when negotiations broke down. It was two members of Congress getting together that represent two very different districts. So what this does, it allows states and those governors of those states to waive out of some of the Obamacare federal mandates. So it pulls the decisions back to the states, allows premiums to come down. In fact, we have some independent analysis that would indicate as much as 36% drop in some of our premiums. So we're encouraged by that. That was the big thing for the Freedom Caucus, is as long as the average consumer could open their bill and say, this went down, not up, and they could celebrate.
Listen, I covered President Trump's campaign for more than a year. We went all over the country. And I want to ask you this from getting out of the weeds, so to speak, for a second. What do you say to voters, to Democrats, to Republicans who voted for a Republican-controlled Congress and a Republican-controlled White House because they wanted the Affordable Care Act either repealed, replaced, fixed, whatever? Really, they wanted their premiums to go down. What do you say to folks who are watching this all unfold and just saying, why can't Washington get it done?
Well, I would say two things. One is, you're right. It is about getting premiums to come down. They could care less what you call it, as long as premiums come down. But the second part of that is this is a president who will not take no for an answer. I mean, he's going to get it done. You were on the campaign trail with him. You saw the thousands, tens of thousands of people that would show up. He's got a board in the White House that takes every campaign promise and he checks it off. And so this one, he's not going to let Congress stand in the way. But I will say it took 17 months to get Obamacare put into place. We're probably going to have this out of the way, or at least modified, in 17 weeks. And so sometimes the expectation doesn't realize the slow pace of which Congress works.